Welcome to On the Issues with ABC News senior White House correspondent Martha Raddatz and the Brookings experts for a dialogue on policy ideas. Healthcare is the nation's largest industry. Senior fellow Henry Aaron says the next president must address our healthcare system.
The next president and Congress will have major health policy decisions to make. Why so critical at this point?
American health policy suffers from three almost equally important problems. One is that an increasing number and proportion of Americans really don't have access to health care because they're uninsured. The second problem is that costs have been rising much faster than income and are coming to squeeze the federal budget and private budgets as well. And the third problem, less remarked upon but equally important, is that even those of us who are well insured don't get value for money because the quality of American health care is really not what it should be.
So what would you like to hear presidential candidates or the next president do about this?
Well, let's start with the low-hanging fruit, the quality of health care. America has tried on a number of occasions, Congress has tried, supported agencies that would carry out research on effectiveness, what really works, what is cost effective. Unfortunately, these agencies have done their job and reported sometimes that interventions or new techniques in which people had invested a lot of money really weren't worth it. And angry constituents have then gone to Congress, and the result has been that these agencies have had short and inglorious lives. So the first job is to take on this problem in a serious way and create an agency with enough political independence and financial backing to begin to mount a major evaluation effort to tackle the majority of healthcare procedures that have never been well evaluated. See what works so that physicians, insurers, and patients can be told reasonably, X doesn't work, Y does, it's cheaper, you should have that. That's the sensible way to try to save money or to reduce the growth of healthcare spending. With respect to access to care, the uninsured, there are a variety of competing proposals. One approach, which I suspect a Democratic president would tackle, would be once again to try to get Congress to enact a major national proposal to extend coverage to those who are uninsured. Another approach, which I think has considerable promise, is for the federal government to back efforts by the states, individually and perhaps in slightly different ways, to extend coverage within their own borders. They're not going to do it on their own. The experience in California, where the state legislature rejected a state-based program, illustrated the problems that states run into and the reasons why they need federal support. So I would hope that we would see efforts along both tracks. If the national effort could succeed, that would be good news. If it can't, and one has to be skeptical in light of the history of unbroken chain of failures, if national reform doesn't work, then encouragement of state efforts does hold out the promise of very significant extensions of coverage.
And you talk about that unbroken chain, and there's certainly been so many failures. Does anything give you hope that things could be different this time around?
The ice is cracking, but whether there's enough movement yet for national action is questionable. The improvements are that I think business has come to recognize they can't solve this problem, the problem of rising costs, on their own, and they don't want to have to deal with it. I think that the energy shown in numerous states, even if not always successful, to try to enact reform proposals, indicates that there is a discontent, a desire for government-led action, whether at the state or the federal level, that hasn't been present in the past. But the obstacles remain formidable, and if you are asking for the odds that Congress will this time around actually enact a bill, I would have to say they're well under 50-50.
Okay, thank you, Mr. Aaron.